Okay. Hello. So I am going to be discussing the respiratory system. This is a model of our lungs. So this is your chest cavity, and then your diaphragm sits here. The balloons in here are your lungs. This is your airway. So this is your bronchial tubes that bifurcate off from your esophagus if these were clamped together. So your bronchial tubes, they bifurcate from your esophagus down into your lungs. In your lungs, you have what we call alveoli. Alveoli are those tiny little vessels in your lungs, and they actually have sacs at the end that open up that allow you to have that peripheral effusion. So if we were to, let's see if this works. I haven't tried it yet. So I don't know if you can see, but the lungs are inflating. At least one is. Okay. So here, let me try this. So when we take a deep breath in, the balloons act as our lungs. They will expand. So in a case, if someone has asthma, this can be very difficult. The vessels inside of the lung tissue will contract. So it will look like this. You see the difference? So whenever someone is having an asthma attack, we always try to say it is almost as if you are sucking air through a small straw. What happens to the alveoli in your lungs is that they have some mucus surrounding it. So there is no like easy gliding able to open up and allow the oxygen to come in, the CO2 to come out. So a lot of times people with asthma attacks, they'll hyperventilate. And so what that does is that you are breathing in so much CO2 and you're not allowing it to expel out, which can create hypoxia. Hypoxia is a basically decreased airflow, and you don't have enough airflow that is getting to your brain. So if you don't have enough air and oxygen circulating through your lungs and your brain, it also flows through your organs. You go into what we call respiratory failure. So, certain things to understand if you have an asthmatic patient, you want to educate them on listening to their body. You want to make sure that they are aware and they understand when they have attacks and what that looks like. So, is your chest tight? Are you having shortness of breath? Are you coughing a lot? Is it hard to get a full breath in? If that is the case, then you educate them on a rescue inhaler that they can have. Typically, it's albuterol. They can take one puff as needed. Sometimes, if the asthmatic is pretty severe, the doctor will prescribe what we call like a steroid, like Advair. Now, this is something that they take every day. So they can take it every day. It allows the lungs to expand. It allows those alveoli to open up, and now they can get that oxygen in. Now they can get all of that oxygen that they need to function. Because if you don't have oxygen and you're just constantly like having the CO2 in your body, you can hallucinate, you can pass out, you can have decreased oxygen to your brain. So that can also cause issues neurologically. So education wise, we tell our asthmatic patients, listen to your body. There is something we call a peak flow. What it does is it measures the volume of oxygen that they're able to expel through breathing. So we want to make sure that that volume is in a healthy range for their lungs, and that shows us that their lungs are doing what they're supposed to do. And that's just simply like this. So they're having a healthy inhale, exhale, normal airflow. Their saturations are in a stable place for them. If that is in a range where it's not safe, there will be labeled like a green, yellow, red. If they're in a yellow, red zone, yellow, they can take their inhaler as needed. A lot of times, warm liquids can help open up the airways. Or if it's so bad where they're having such shortness of breath and they just feel like they just can't catch their breath, they can give themselves a breathing treatment. They can be educated on how to give a breathing treatment. All of the parts to the SVN, the doctor will educate the patient, let them know how to hook it up, have them do it. That way they can get a good they get familiar with it and they're comfortable to hook it up themselves, disperse the medication, and then they can give themselves a treatment. Also, understanding after this treatment, they will feel a little shaky. Their heart will be going a little bit faster. So it's important to just relax. Another thing that we would like to educate our asthmatic patients. So asthmatic people, they typically have a lower immune system. So what does that mean? So a lot of times around the flu season, when they get sick, it affects this. It affects their lungs. A lot of times, if they get upper respiratory or they get a sinus infection, 9 times out of 10, asthmatic people will also have issues breathing. So it's really important to have them stay healthy. Try to stay away from other sick people because when they get sick, they will go down pretty quick. If their asthma is pretty bad early on in their childhood. So normally asthmatic patients also have allergies, sometimes to food, most of the time to pollen, dander, animal dander, pollution, different types of like dust. That will irritate them and it can almost send them into an asthma attack. So, to educate them and let them be aware of their environment as well as activity. Sometimes it depends. Some asthmatic patients can grow out of it and they can go running, they can jog, they can ride their bike, they can rollerblade and not have an asthma attack, not have any flare ups. Other times it does exacerbate it and it makes it difficult for them to breathe. So let them be aware that don't do such strenuous activity. Listen to your body. Make sure you have your inhaler on you at all times. Doesn't matter where you are. If you're at school, put it in your backpack. If you're at home, make sure you have it in a safe place. If you're at school or work or driving around, make sure you have one in the car. It's just important to always have it. If you're going to the gym or if you have like baseball practice, softball, soccer, if you know that you are going to be exercising, it's important to make sure you have that rescue medicine. That way that you're able to do your activities, but you're not catching yourself in a bad place. So it's important to educate your patients about those diseases. So there are certain seasons that's harder for asthmatics. There's other seasons that's a little bit better. The winter time, it is a little bit more difficult because of the cold, and then also the flu season. So you need to let them be aware of that. If they go to higher altitude, it's obviously harder to breathe, but with asthmatics, it's definitely harder. So it's really important to educate and make sure that they're aware of the things that will help them. Warm coffee, like hot coffee, caffeine actually opens up your lungs. So even though they say not to give coffee to children, but it really does. Caffeine helps open up those alveoli. It allows you to get the oxygen, and then you're able to expel out that CO2, and you're not becoming hypoxic. You're not finding yourself in a bad situation. So know those different methods as well as your rescue meds, and then try to just stay away from things that might harm you. So that concludes my video. 10 minutes.